of all kind, and massage therapists. So really anybody in the health and wellness space can absolutely benefit from having an esthetician relationship in their business.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hadar, my friend, how's it going? You know, I've been thinking a lot more about aesthetics, estheticians. We need a little bit more education around that as dermatologists and as like skincare practitioners, don't we? Like we need to figure out how to work even more closely with this group.
Yes, and we've had a number of estheticians on the program before, including our current guest, Millicent, who's been fantastic at describing the relationship and the community, and I want everybody to go back to that episode. But today we invited Millicent back because you know, Raja, I think she's a visionary. I think she has a vision on how we should collaborate with estheticians, both dermatologists, maybe plastic surgeons and other practitioners to really elevate the practice. So we wanted her to come back, talk to us about this, and we're going to push her. We're going to push her and try to push the model and see if that works. But I have a suspicion she will do great.
Oh, she's going to do awesome.
Reintroduce Millicent?
Yes, let's do a little small intro. So Millicent Russo is an esthetician. She's also executive director and founder of the Integrative Aesthetics Institute. And so she's done a lot of trainings around things like specializing in advanced microneedle training. She's also the founder and the president of the Integrated Aesthetics Association and Scholarship Fund. But, you know, just because that wasn't enough, she's also an important board member of LearnSkin and the Integrative Dermatology Symposium Esthetician track, which is coming up at the upcoming Integrative Dermatology Symposium weekend. Millicent, welcome to the podcast again. It is so fun to talk to you.
Thank you so much. It's my pleasure to be here. Thank you, guys.
And you know what? Let's jump right into it because I feel like you are so dynamic that you're going to be able to give us all kinds of angles on this. I know this has been brought up before, like how to work with estheticians, but how do we work with estheticians, Millicent? Like, what are the different ways?
Yes.
And, you know, you've worked with, like, even before we started the podcast, you said you've worked in almost 16 different settings. So we want to hear it all. And then we want to get some nitty gritties in there.
Yes, perfect. Well, so I've been licensed for 23 years and I've worked with, you know, a ton of professionals in the medical side, dermatologists, plastic surgeons. And what I noticed pretty quickly is the need for estheticians in these practices. And that's where I initially found my niche, was helping medical professionals to develop the aesthetic side of their business. So that's really how I started out, was doing a lot of business consulting. And so I think I have a unique perspective on the needs, not only of the medical practitioners, but also how estheticians can really fill in the little kind of cracks and voids that you have in that practice. And like I was telling you before, before this podcast, I made a list, if I could remember, all the different types of practices that I've worked with. It's 16 different types of practices, all within the wellness and health sort of sphere: dermatology, plastic surgeons, med spas, day spas, hair salons, acupuncturists, anybody in the women's health clinics. So it's OBGYNs and the like, dentists, personal trainers, gyms, chiropractors, physical therapists, nail salons, nutritionists, health coaches, mental health professionals of all kind, and massage therapists. So really anybody in the health and wellness space can absolutely benefit from having an esthetician relationship in their business, because estheticians facilitate that relationship better than any other person in your office, because they have technical training. And generally, estheticians are called to this profession because they have the heart of a healer. So they have this genuine, natural ability to care for people. So they're also that first client touch point, right? They're the client provider touch point. And they often are the first to spot pathology. And when we look at treating the whole person, it takes a team of people to treat the whole person. When we're looking at, the idea of integrative dermatology or integrative aesthetics, we're looking at the whole person. But, you might specialize in something in your dermatological practice. You need to build that professional network and bring on other people or build relationships with other people that can facilitate, again, that care of the whole person. Now, how I love to see estheticians and what I always recommend to, business owners is that estheticians make fantastic client facilitators. So they're very good at helping your client understand what treatment options are available to them. Because we often see with our clients, that's one of the biggest gateways to scalability. Because let's say you want to bring on this fancy laser, or let's say you want to bring on what XYZ treatment. How do you get your client to understand the benefit to them? Oftentimes the doctor doesn't have the time. This is where your patient facilitator comes into play. And an esthetician is a perfect person, more so than, let's say, your front desk staff, your people who are checking people in and out, because estheticians have technical training in these types of aesthetics fields. And if they might not know laser, that's okay. They still understand the skin and they understand how lasers can work on the skin. So education, I always think, is the natural facilitator to sales. And there's no one poised better than an esthetician to facilitate that education to your clients.
I wanted to ask you, are there specific gaps, and I'm going to focus right now on medical doctors because you mentioned a whole slew of them, right? That maybe, you mentioned obviously the idea of the esthetician as a liaison between the doctor and the patient in order to understand what kind of treatments are available. Are there any other specific gaps that you find that estheticians can fill for MDs or DOs or, those type of practitioners? Are there any medical diagnoses that maybe they pick up more frequently or maybe highlight certain issues that the patients maybe don't feel comfortable bringing up to the doctor?
Yes, absolutely. Absolutely. So they do, skin cancer is probably number one that an esthetician can pick up, maybe quicker than a dermatologist, or we often see that the client comes into when it's an advanced degree of pathology, where if they're getting their monthly facials with their esthetician, the esthetician can kind of see the growth or the progression of those lesions over time and can oftentimes catch it sooner than they can with their dermatologist.
I love that you said that because this highlights the need for collaboration, right? It's the frequency of care. And so the need for education, of dermatological education for the esthetician community, which incidentally is what we're trying to do here at LearnSkin and bring together these two practices. So, because this is so important. Often people talk about the hairdresser that picks up, certain pathology about hair loss. And I think the esthetician and maybe pre-cancer, cancer, just really highlighting those lesions that need to be taken care of. Maybe they play a bigger role than we think.
No, yes, yeah. And in addition to that, really, it's any pathology. So a good esthetician is going to understand her scope of practice or their scope of practice. So they'll know when you have a folliculitis or a dermatitis of some kind, and an infection of some kind is out of their scope, and then that's when they know to refer it out. The other holes that you'll find also depend on scope of practice, and that's determined by the state board. So, if you're looking to kind of scale and bring on estheticians, the first thing you're going to want to do is understand what their scope of practice is. And that's how you can find where they can fill in your holes. So some states they can do laser, some states they can do injectables, some states they can do microneedling or chemical peels or those types of things. So understand that scope of practice. You can hire a consultant, somebody like myself, to help you with that, or even just contacting your local state board to understand that scope of practice. And then if you're not ready to bring on an esthetician, build a professional network with one in your community that gets good reviews and build that relationship, because again, it takes a whole team to treat the whole person. But if you are ready to bring one on and you do want to hire an esthetician, there are a couple of little things that you can look out for in an interview. So I'll give you a couple little tips and a fun game that you can play.
Oh, I love games. Let's play a game. Come on.
So estheticians, not only are we trained in a technical skill, we know ingredients and skincare products like the back of our hand. Now, we can't undersell skincare products because we know that even just a disturbance in the pH on the stratum corneum can set off a cytokine reaction that can affect the lower layers of the skin. So even just a disturbance, so even if it's acidic or it's alkaline, can even just cause a disruption. So ingredients are really key in understanding how to use them appropriately per the skin condition. So that's an esthetician's specialty. And the game that you can play with an esthetician is grab a bottle off your retail shelf and put a piece of tape or something over the label so nobody knows what it is, and have the esthetician read the ingredients on the back of the bottle, and they should be able to tell you what that product is used for and or what types of skin conditions it will treat. So the importance of product knowledge in skincare cannot be understated. How am I using the word right?
Ooh, I love this game. Do you have other games? I love this riddle. I don't know if I would pass it.
Yeah,
By the way.
let's show Hadar a list of ingredients and let's
Yeah.
see,
And I'll let you know if you can eat it or not. Okay.
Yes, exactly.
Well, you can eat it. It might not do well after that, though.
You know me.
Good.
Eat first, think later. Okay.
Yep, exactly. So that could be just a fun sort of game that you can play to understand the depth of continuing education that the esthetician has sought. And that's another thing I think to look for when building a collaborative relationship is oftentimes aesthetics licenses meet the bare minimum of an educational requirement. And so we really want to see educations that take the initiative to continue to build their educational, profile, continue to build their what I like to say is you put things in your basket, right? Your education's in your basket. You pick up little things along the way, and then eventually it builds this wealth of experience and knowledge that you can draw from when we're treating the general public, because all types of people are going to come into you from all different types of walks of life and backgrounds, and it's our job to be equipped to treat everybody that walks through our door.
Yes, I love this. This is excellent. And I think one of the things that's important in this knowledge about products and ingredients is that many clinicians would want to add, let's say, a product line or product lines to the portfolio and the practice. And oftentimes we're not taught this stuff, and maybe it's hard to think about it. So an esthetician who's well trained in that can perhaps help us to think together about what we want to add and how to do it in a successful way, because they are trained in that side of the business, which dermatologists, other medical providers may not be so trained. I wanted to ask you, are there any subspecialties that estheticians tend to choose and focus on these areas? And if so, how do they match perfectly with certain specialties within medicine? Is there a game like that we can play where match the subspecialty with
Actually,
the
can I even
specialist?
follow up on that? How do you choose whether you're going to work with, say, because I'm sure the vast majority of them, if they are pairing up, it's going to be either a dermatologist or perhaps a plastic surgeon. But yeah, if you don't mind answering how you choose, but then maybe between the two, even between those two skin or aesthetics focused specialties, how do you choose even then?
That's such a great game. I need to put that together. I need to put those little pieces together and make a game. But absolutely. So aesthetics has evolved to a more specialized practice. Back in the day, it used to be this large smorgasbord, but the industry is changing, and we're all, kind of falling into these niche markets or into our specialties. So let's say a plastic surgeon specialty is, obviously facial rejuvenation. That's a perfect complement to a laser technician or somebody who specializes in microneedling or chemical peels. Those are all things in certain states that are within the scope of an esthetician. And you just look for that on their resume. Have they continued their education and what experience they have? Some estheticians choose to specialize in more of, I want to say, the spa side or the relaxing side. Oftentimes estheticians will be dual certified in massage as well. And that would fit the more spa model. But, you just look for that continuing education and that experience on the resume.
And I wanted to ask you, because as now we found the right esthetician that matches our practice, maybe matches our goals of growth for the practice, how do we retain an esthetician? How do we keep one happy? Because obviously these are sought after experts, and it's a free market. And I've seen practices where they bring in an esthetician and that person, for whatever reason, decides to leave. Now, this can be, because they're not treated well, but also sometimes, competitive practices, maybe not play nice. And so they get a better offer, they take clientele. You start to get all these little games that maybe people don't want to talk about, but I'd like to bring to the surface. How do you handle these issues in a professional way that keeps everybody happy?
Yeah, that's really an important part of, all working relationships, is making sure that everybody feels valued and appreciated. I think oftentimes estheticians feel intimidated or perhaps undervalued when they work in a more medical type practice. So I think being mindful to recognize the esthetician's value and making sure that they really feel that. But also, estheticians love to learn. That's another one of our little quirky traits. So if you bring on an esthetician, teach her stuff. Teach her how to do stuff. For instance, in the state of Arizona, you don't need a special certificate or a license to become a medical assistant. So I remember one plastic surgery office I worked with, he taught me how to remove sutures because that was under his oversight and that was within the legal workings of our state. And that was great for me. I felt like he trusted me to help facilitate the patient care, and that further connected or solidified that relationship.
Millicent, I have another question for you. One of the things that I've also noticed is that sometimes people will ask about giving tips. We'll have our patients come and talk about giving tips to the esthetician. I suspect because it's more, they feel like they're not happy to see us all the time, but they're pretty happy to see the esthetician. So I'm curious what your thoughts on that is. Like, what are the different reimbursement models that are out there? And I'm not asking for what you think is the best, but what are the different models out there?
Yeah. So you can hire on as a traditional W-2. Tipping is interesting. I find that it is a regional or cultural sort of, social norm or more. So certain areas tip and certain areas don't. So, and traditionally in medical practices, a tip is not expected. But to compensate for that, usually a higher hourly wage then is expected from the esthetician. Of course, when you're a W-2, you provide all the supplies and tools that they're needed, or you can hire one on as a subcontractor or 1099. And that's where they would bring in all of the products and then, of course, bill you and act as sort of that subcontractor. Perhaps they even rent the space from you. That relationship tends to be a little bit more different. I don't always find those relationships to work as cohesively as when the esthetician is in a W-2 position. They also can operate on commission as well. We see that frequently with retail sales, is the esthetician will get an additional commission on the retail sales. So there's an incentive there.
Excellent. Millicent, you mentioned other practices, which I think most people don't necessarily think of an esthetician as the person that they will meet when they come through the door to a gynecologist or an acupuncturist. Can you describe those models, how the esthetician really elevated the practice in those scenarios?
Yeah. So when we think of wellness, we think of caring for the whole client, right? So that's our wellness sort of model, is the intention to care for ourselves and to be as whole or as complete as well as we possibly can. So an esthetician fits in that model because they help that outward appearance. Unfortunately, we do live in a culture where we're all kind of looking at ourselves and judging ourselves. And, I see this spot or this wrinkle. And an esthetician really can come in and help alleviate some of those issues that people feel with their outward appearance. And once you get into a service with an esthetician, it becomes more than that, to be honest. It really comes more of caring for the whole person and caring for their soul, because you're touching the other human being and you're transmitting that energy. It's a sharing of energy and healing with the other person. So yes, we focus on the outward appearance. Healing really goes much deeper than that.
So I think I heard you say that in any practice, really the primary care physician, be it the gynecologist or any other primary care doctor, an acupuncturist, any practice that has to do with health, there's a role for the wellness part, for the integrative part to say, hey, we care about the whole of you, and an esthetician is a testimony to that. And we hire a person and we pay them and we want them to be on board because we want you to become better for whatever that means. And I like how you highlighted, you're not the first esthetician to mention this, to at least to me, that physical component, touching your client or the patient, really adds a lot to the connection. There's some energy that goes there, and I totally agree with you. It is absolutely real. We may not be able to quantify it exactly, but for the susceptible patient that's willing to go through for the ride, there's definitely a lot more that an esthetician can offer than just the skin feeling great.
Yeah, absolutely. Absolutely. And, I just read this study that talked about the perception of the client was more important to the outcome than the actual outcome, if that makes sense. So how the client perceived the treatment
that's
determines,
very interesting.
right, determines the efficacy.
We actually know this to be true in, I think, many cases. Even if you're in an argument, if you can make the other person feel heard, the argument goes much better. Not that we argue at all, right, Hadar? It's always agreements here.
I totally disagree. No, I'm joking. Yeah, I agree 100%.
And that's really the esthetician specialty, right? Is in that positive sensory experience. And that overall gives the client the impression of your practice. So it's really a win-win.
Well, I like this win-win approach because it's a great way to end another episode. Oh my gosh, Millicent, you add so much every time you come, and we may need another episode. I'm really happy that you joined us. Thank you so much for this excellent, very practical tips. And you really helped me understand how an esthetician in a real way can be part of a practice, of any practice. I thought, oh my gosh, I thought just dermatologists, but what do you know? Maybe next time you go see your local acupuncturist, an esthetician will greet you at the door and you will start delving into a world you never thought you will. So thank you for doing that. Thank you for your expertise and looking forward to seeing you at IDS.
Thank you. Thank you guys so much.
Thank you so much for supporting us through the last several seasons. We love receiving your questions on social media. And now you can call them in as well.
Yeah, exactly. So if you're a licensed medical practitioner, call us at 424-309-8757 and leave a detailed recording with your name, location, clinical question, and it may just be chosen to be answered live on the next podcast.
We look forward to your submissions. And as always, stay curious.